Good evening. This is Amy Morton welcoming you to Lester Miller's Town Hall teleconference this evening. Lester is a candidate for Macon Bibb Mayor, but tonight we are hosting Dr. Maher Abdulla, who is a Middle Georgia internal medicine doctor with more than 24 years of experience. And we are so grateful that he can join us this evening to be with us to answer your questions during this crisis that we're dealing with in our community. During tonight's call, you're going to hear from Lester Miller, you're going to hear from Dr. Abdulla, and then you will also have an opportunity to ask questions. And if you would like to ask a question during the call, simply press 7 on your phone and you'll be placed in queue to have an opportunity to ask your questions. So with that, I'm going to turn this over to Lester Miller, who will introduce Dr. Abdulla.
Good evening, everyone, and thank you for participating in our Tele-TownHall this evening. We appreciate everyone taking time out of their busy schedule for this very important meeting. As a community, the health and safety of everyone in Macon must be our top priority. As many of you already know today, Mayor Rickard has announced a state of emergency for Macon Bibb, and the situation is evolving rapidly. Make no mistake, we are facing a serious health crisis right now. I encourage everyone to follow all the safety advice of healthcare professionals. But in order to get through this difficult times, we're going to have to work together as a community. And I'm already encouraged by the solidarity and spirit of service I'm seeing from so many people in Macon. First of all, we'd like to give thanks to our health professionals, including our doctors, nurses, EMTs, and firefighters. We're also thankful for the great work of the Macon Bibb County Emergency Management System, the Macon Department of Health, our police and other first responders, and critical workers who are also on the front lines fighting to keep us safe. At this time, I want to introduce Dr. Abdulla. Dr. Abdulla, if you'll tell a little bit about yourself, and then we'll begin with the question and answers tonight.
Right. Thank you for the opportunity. My name is Maher Abdulla. I'm an internal medicine physician in Warner Robins, Georgia. I've been there for more than 24 years. We practice in comprehensive care medical offices with 2 other internal medicine physicians, and we have been serving the city and the county since 2001 in the location on 301 Ossegian Boulevard. And I'm very happy to be in this whole meeting through this teleconference to help our fellow citizens know more about this ailment that we have been affected by. As far as it goes for this infection, it is caused by a virus called coronavirus, and it is unfortunately a sequel for a prequel of the same syndrome of SARS, which is a severe acute respiratory syndrome, SARS. The first one that was described was in 2003, and it did spread to at least 24 countries in North America, South America, Europe, and Asia before SARS global outbreak of 2003 became contained. The coronaviruses are known to be very contagious, but unfortunately this one, which is COVID-19, which is a short description for coronavirus disease of 2019. So this current one that we have is unusually contagious compared to the previous one. We want to think that it is another form of the flu that will eventually pass, but the more time goes, the more we realize that we know less about it. And the unknown part or the unknown aspects of this infection and how it spreads and how it should be treated, how it should be prevented, and when are we going to get a vaccine is the most painful, lengthy, and tiring part. And while time passes by, you could tell by looking at the screen the increments in thousands of people getting infected. I know it sounds that it is all bad news, but there could be some good news at the end of the day that we will eventually control it. We will eventually, hopefully, get rid of it by getting a vaccine and develop what we lack. And honestly, what we lack here is what we call herd immunity. Herd as in H-E-R-D, which is the immunity that a population or people on Earth would develop by repeat infections and repeat vaccination. And this way, we will eventually be able to regard this infection like a regular influenza. But until that time reaches, we will probably accrue a lot of sick people, a lot of people who would die, a lot of people who would lose their jobs because of the economic impact of this infection. What we need to do is listen to our government, listen to our health professionals, follow steps. Most important one is social distancing. As I mentioned earlier, this is a very contagious disease. The way it spreads is not very clearly known, but we know it is by air droplets, which is basically air-lifted secretions that come out of the mouth or the respiratory tract of the infected individual. That's why social distancing or keeping a distance of 3 to 6 feet is very important from any other person. Unfortunately, with coronavirus, you could carry it or you could have it without having a single sign or symptom to tell the others that, hey, you might have it. So the spectrum of the symptomatology can vary from just being a carrier, where you have literally no symptoms of fever or cough or sneezing or pink eye or body aches or nausea or loose bowel movement or loss of taste or loss of smell or shortness of breath. You could have somebody with all this absolute asymptomatic state to all the way somebody on a ventilator, crashing with low blood pressure, having fever and chills, can't keep his oxygen up, and probably is in a coma. So that wide spectrum is what baffling and what is puzzling. And a lot of patients, particularly the young, the healthy, the ones who do not smoke or vape, are typically the ones who will literally have no symptoms. And they could be just a person or a vehicle or a host to that virus and pass it around. That's why social distancing and doing the 5 steps or the 5 precautions comes very handy and become very important.
Dr. Abdulla, we have a question. Could I interrupt you for one moment? From Sarah, who would like to know how long the virus lives on surfaces. She's concerned about packages at her door that come and those kinds of things. She has someone immune compromised in her household and wonders about whether if she gets a cardboard box, that sort of thing from this delivered, if she needs to be concerned about that.
Yes, this is actually a good question, and unfortunately, we don't know exactly how long does the virus survive outside the host, but it all depends on the temperature and depends on how much moisture is the virus in. So the drier the situation, the more it would kill, the more the chances that the virus is dead or to be killed. So it's very important that if you have packages out there, to handle them with care, to make sure that there is no moisture or wetness or water in them, because in these circumstances, the virus would survive longer. Typically, I would say once it dries out, the virus probably would die or would not survive within less than 30 minutes. But it has to be a dry surface. Typically, heat should kill this virus, but are we sure? We're not. So this is not solidly answered, but I could say with some confidence that the drier the packages, the better it is. And again, handle it with care.
Let me also remind everyone on the phone, if you haven't heard already, if you would like to raise your hand to ask a question, you do that by just pressing 7 on your phone, and you'll be placed in queue. We have several questions waiting. We have a lot of people who are interested in this evening. So the next question that I have is from Matt, and it is simply, what is the most common type of transmission? And that is also for you, Dr. Abdulla.
Okay. Well, it's transmitted from another human being who is within a reach, I would say 3 to 6 feet. Typically, it is droplet infection. And we mean by droplet infection that the person will cough or sneeze some of his mucus liquid that comes out of his nose, from his windpipes, and from his lungs. And they say that if you are not within the area or the diameter of 6 feet, you should not get the infection, as it would gravitate to the ground. However, this is changing by the minute, because a newer report that I just read talks about that the infection can be airborne. In other words, the virus can stay in the air for a few hours after the person coughs or sneezes, and if you happen to pass by that atmosphere that contains the airborne part that has the virus, you could get sick. This is, again, theory. However, it is ever evolving, and I want to really make sure of this, that everybody understands this point. Whatever we know now could change within 12 hours. Whatever we have it as a solid piece of information that we can pass could be negated or could be disputed within 12 hours, or even less or more.
I'm going to pause again because we had a lot of people join the call in the last minute, and I want to welcome those who've just joined the call and let you know who you're on the phone with. We're hosting Lester Miller, who is a candidate for mayor, is hosting a town hall this evening with Dr. Maher Abdulla, who is a local Middle Georgia internist who with more than 24 years experience, who has been gracious to join us this evening to answer questions regarding the coronavirus situation that we're all dealing with now. If you would like to ask a question during the call, please just press 7 on your phone and you'll be placed in queue. You can go ahead and do that now. We do have an additional question from Susan, and this question is initially for Dr. Abdulla, and then Mr. Miller may also want to give us some guidance. The question is, Macon was placed in under a state of emergency today, according to by order of the mayor, and the question is, do you believe that was a helpful step in terms of controlling the transmission of the virus? And would you have any comment about that? Dr. Abdulla, or do you want to go first and then?
Absolutely. I mean, I fully support this decision or this order, because as we said, social distancing will eventually prove to be the only thing we have in hand to help stop the spread of this infection, as we assumed that it is very contagious. As we mentioned earlier, that it is unusually contagious compared to the influenza virus infection itself, as each sick or host that carries the virus could spread it to 6 other people before the patient presents to the ER or to the physician's office for treatment. So preventing social activities and asking the citizens to practice social distancing, along with washing the hands and cough into the elbows and not touching the face, and keep the distance or safe distance from others, as well as staying home if possible, would be the 5 steps necessary to help us control the spread of this disease that is regarded as a fatal one if it affects an elderly individual or somebody with pre-existing or compromised immune system.
Thank you. And Mr. Miller, can you comment on that from the standpoint of leadership in the community, the emergency declaration, and your thoughts about that?
Sure. Of course, I received a copy of it. I did post it on our Facebook page today, a copy of the emergency administrative order that Mayor Rickards signed into legislation today. Of course, this is something I wish had been done a couple of weeks ago. It's imperative that we get all the information out to the public to understand that safety is our primary concern here. Not trying to scare everyone, but we do need to take it serious. And I believe that the safety of our citizens are our primary concern. The other thing is we have to make sure that everybody realizes it's just not something that the elderly would get. I'd hoped today when the Governor Kemp came on at 5 o'clock that he was going to be a little bit more restrictive. We have to take steps now, and we can't afford to wait another day, another 2 days. One of the things that was very disconcerting to me was, information came out from the local government on Friday that we would actually be doing this state of emergency on Monday. But unfortunately, we sat all day Friday, Saturday, and Sunday before it went into effect on Monday. And I think this is something that every day it goes by without taking these precautions is going to be, a situation where more of our people are affected. The second part of this equation I think we need to do is not only talk about how do we prevent this and how do we flatten out the curve, but also we have to begin to think about the economics involved in this. And the mayor and the commissioners need to have a plan, and the plan needs to let everybody know that we're going to get through this. We're not asking you to take this punishment for everybody, and we're not going to ask you to go out of business, but there needs to be a financial plan on how these businesses are going to survive this, and we're going to have to be there ready and able to help them out in this situation.
Thank you for that question. That was a very, very important question. We have another question from Mary, and this question is for Dr. Abdulla. The question is if she feels like she's having symptoms that are consistent with coronavirus or could be consistent with some other respiratory ailment. What is the first step she should take?
Well, this is a very common question that we get to our clinic, and we have received so many of them. And I would tell that you have to use common sense. Honestly, anybody could have COVID-19 or the coronavirus infection. Anybody can have it with or without symptoms. If the symptoms are not severe, when I say not severe, I mean the patient does not have high fever greater than 100 degrees Fahrenheit. If the patient does not have painfully dry cough that is persistent and does not have any shortness of breath, I think the best thing to do is self-quarantine. Stay home and let time pass, because honestly the test is not readily available everywhere. Even if you go to the ER, probably the ER physician will employ his best discretion and probably will decide that you are not that sick and you probably just need to go home, particularly if he finds out that you don't have neither flu nor strep. Then he probably would tell you just go home, take Tylenol, drink a lot of fluids, stay away from people, and it usually passes within 7 to 14 days or less. But if the patient has really serious body aches, nausea, has headache, shortness of breath, can't think right because his oxygen is dropping, so he's panting or he is tired and he's about to pass out, or he has horribly dry cough, it is time for you to seek help, to go to the ER, and I know any local hospital is equipped to handle cases of COVID. And when I say needs to go to the hospital, be ready to get admitted, because once you have what we are worried about the pneumonia that comes from the corona, then you can't be out in the public or at home because you will definitely get everybody sick. So only if you feel that you can handle your illness or your sickness and you are desperate, then you need to really go to the ER where you will be handled by a well-trained physician and staff.
Thank you so much. Go ahead, I'm sorry.
I want to add that if you go just simply because you thought you might have COVID-19, there is a good chance that you don't have it. And you go to the ER and somebody is coughing horribly, and here you go. You get it from him. On the other hand, you don't have a bad case of COVID-19. And you go to the ER, and next to you is another elderly woman who is there for a UTI, and you sneeze or cough, and you give it to her, and 3 days later she's dead. So I hate to give these extreme examples, but I've been educating my Facebook friends about this, that if you can handle it, stay home, drink a lot of fluids, quarantine yourself, take Tylenol, remain hydrated, and I think hopefully you will do well.
Again, very helpful. Thank you so much. And we have about 5 more minutes on this call, and so we have time for a couple of more questions. But we have one more, and this is from Aaron. And Aaron, this question is for Mr. Miller. And the question is, Aaron's concerned about first responders and the people who are on the front lines dealing with this issue, both healthcare providers and others. And the question is, what can we do to support them as a community?
And Aaron, that's a very good question. I think the number one thing we can do that we've already discussed this evening is to make sure that we self-quarantine and make sure we don't go to the doctor for things that are not associated with the COVID, because you do take a lot of the time, energy up of the first responders. I think the other thing is we need to insist on our government to make sure, our local government, that has all the necessary medical equipment there that our firefighters and our police need, that come into touch with these folks. I've spoken to many firefighters already. They tell me that they're very lacking on the equipment already, and that's a great concern to me. We need to make sure that they have the best. But the more that we can limit the exposure to these officers and these EMT workers and these medical professionals, if you've got a procedure coming up, then postpone that procedure if it's not life-threatening, because we need all the hospital space and the hospital beds that we can have at this time. So I think those are some of the best things that we can do. Our first responders are the backbone of our community. We need to protect them. Unlike the people today that found out that they could not go to work as non-essential employees, the first responders don't fit in that category. They don't have the opportunity to take off 2 and 3 days. They don't have the opportunity generally to sit out 7 or 14 days because, number one, we're short on officers and firefighters. Number two, because of their job and their description, they're a necessity each and every day. So we need to make sure we protect them. We can continue to pray for them. We can continue to donate things that they may need at the fire stations, at the police department, that we have in our household that they may need. So I think those are two of the things that we can do on top of just basically self-quarantine if we think we have any of these issues.
Okay. We have our last question, I believe, from Chuck. And this is for Dr. Abdulla. And Chuck's question is, what is the course of therapy? Have there been any studies about the effectiveness of Z-Pak or quinine? And how many cases of the flu have you seen this year? And is this normal?
It's a good question, actually, and it's I would say it's $1 trillion question. Unfortunately, the pain that surrounds the whole pandemic centers around two main themes. Theme number one, how to treat it. Theme number two, the vaccine. Neither of those is present at this time. However, from previous studies and from the prequel, I will call it, SARS-1, the one that happened in 2003, there have been anecdotal data showing that quinones like chloroquine that is used for malaria, and Plaquenil, which is hydroxychloroquine that is used for autoimmune ailments, rheumatological arthritis, as well as malaria, have shown efficacy in reducing the spread and the internalization of the virus into the cells. So did Zithromax. This is probably the only combination available to treat somebody in the hospital who needs this medicine to save his life. Unfortunately, people will think that I could keep that medicine through a prescription at home just in case I need it, which is very dangerous to do, as the side effects can be very detrimental and painful. As far as I see it, I think we will eventually get over this epidemic or pandemic. I think time is on our side. I think it is going to look like another flu. Reading the reports about the case fatalities of this viral infection, I think it's a little bit worse than the influenza that we see every year in the United States. In the United States, we have 50 to 55,000 deaths a year from influenza. 40 to 50 or even 60 million Americans do get acute influenza. Some 400 to 600,000 get hospitalized every year. So looking at the overall picture, we did not have the catastrophe that we hope it will never or it will ever happen. But what we are doing is trying to prevent a catastrophe. And of course, we understand it because unlike flu or influenza, we have no treatment and we don't have a vaccine. And this is where the problem resides. So the problem resides in the lack of definitive treatment and definitive vaccine. And to complicate the matter a little more, we don't have available test kits to tell who has it and who doesn't have it, or who carries it and who doesn't carry it. But eventually, we will get there, and hopefully, as a country and as a whole wide world, we will win the fight like we did before with other infections, and we will get to take more care of ourselves.
This is the last, I said that was the last question, but there was one more that popped up on my screen. I'm going to try to sneak this one in, Dr.
Sure.
Abdulla, just to put you on the spot. Patricia would like to know if you have any projection about what the duration of this situation might be.
This is another part that is still in the dark. Honestly, we have to reach a plateau before we could tell when it will end. We have not reached the plateau. We are still probably, and unfortunately and painfully, in the beginning of the up curve line. And we have to see a plateau where we have a steady numbers of people who are getting diagnosed, and then a decline in both the number that are getting diagnosed and the number of people who are dying of it. Then we could say, here we have this period of time that we could say that we will be safe. But I believe this virus may be heat sensitive. So in our area, as the weather heats up a little bit, we may see a decline, but I'm not really sure of that. But this is just from knowing coronaviruses and all other RNA viruses that does affect the respiratory tract, they tend to decline in the frequency and severity as summer approaches.
Thank you so much. I'm going to kick this back to Lester now to wrap up. Thank you. I'll stay on for just one more moment.
Dr. Abdulla, we appreciate you taking time out of your busy schedule today with all that you do to educate us on this virus, and thank you for all the information that you provided us tonight.
Anytime.
This is for everyone, but we will get through this, and we'll come out stronger than ever. That's part of our DNA is making residents, but we have to work together. We have to listen to healthcare professionals, and we have to support our neighbors in ways that are going to keep us all safe. I thank everyone for being here today. This is one of many that we'll be hosting. Since we're in this environment where we need to stay home and stay safe, we'll have several of these Tele-Town halls, and each one will have a specific issue on each night that may be of interest to you. Thank you very much for listening in today, and this will conclude our conference call. Thank you.